2, say word. All right, challenger number. Conrad, are you ready? Oh, yeah, okay. I hear wind chimes. Do you hear that? Is that somebody's phone? I was like, are there unicorns coming? They got unicorns at the Aspen Institute. Joshua, where are you? Joshua asked during the break, where can I get in contact with Liz? Where can I ask her more questions? I said I was going to find out. But you have this at your table. All of your speakers, I was on Facebook, stalked every last one of them. This is a resource, so don't forget to use that. Now, our next challenger has an impressive bio, and I'm just going to read just a few things. Jennifer Valenzuela oversees the People, Culture, and Equity Strategy for Health Leads. It's a nonprofit organization that envisions a healthcare system that addresses all patients' essential needs. Y'all can snap for that. She is a licensed independent clinical social worker, has worked in the emergency departments of Boston Children's Boston Children's Hospital and Brigham and Women's Hospital, providing psychiatric and social crisis intervention. I asked Jennifer, tell me something else that's not on this paper. And you know the first thing that she said? She said, I am a mom, a mother of 2, and I am a wife. This is a real person. One time for the culture. Y'all give it up for Jennifer!
Morning, Dallas. Thank you. That was lovely. I think we need to do a little bit of movement. So what I would like to do is a little game of Simon Says. Does everybody know Simon Says? Okay, let's get that blood pumping. I also heard some people are cold in here. So we're going to move so we can get warmed up a little bit, okay? All right, Simon Says, stand up. Simon Says, raise your right hand. Simon Says, lower your right hand. Simon Says, raise your left hand. Raise your right hand. And sit down, all of you. Sit down. Stay standing up if you haven't. Simon Says, stay standing up if you're still up. And we're just going to keep moving people on. Okay, Simon Says, shake your right leg. Simon Says, stop shaking your right leg. Simon Says, shake your left leg. Simon Says, stop shaking your left leg. Simon Says, put your left hand down. Simon Says, touch your nose. Touch your eyes. Sit down if you just touched your eyes. Okay, Simon Says, shake a little bit. Show me your moves. Show me what you got. Simon Says, stop shaking a little bit. And Simon Says, put both your hands up and wave them all around like here so you're just moving a little bit more. Simon Says, sit down. Simon Says, stand up. Simon Says, sit down. Stand up. Mr. Garcia, I saw you. You're down. Okay, all right. Feeling a little bit warmer now? A little bit more awake? Okay, all right. We're going to get started now. Thank you for playing that game with me. So I'm going to ask you, we're actually going to do a crash course public health here. We're going to do a master's level population health 101 in 15 minutes. Are you all ready? Okay, so we're going to skip the bachelor's level and we're going to go right on to the master's. I have a master's in public health, and when I was working on this, I started realizing this is some dense material that I'm going to be talking about right now. And so I need your eyes, I need your minds open, and follow me. We're going to talk about some data, and we're going to talk about health disparities and inequities. Okay, you ready? Okay. So if I was to ask you, how much of your life is dependent on the air you breathe, the water you drink, the transportation that's available in your area, the housing that you live in? What percentage of your life, your health, do you think is dependent on those things? What percent? Shout them out. 100%. I heard 1. I heard 90. Did somebody just say 90%? 100%. Okay. All right. So not quite 100%. It's actually, how do we get this thing moving? There we go. It's actually 10%. And you get to sneak and see a little bit one of the next one. But it's actually 10%, okay? So the air, the water, 10% of your life, your health, is dependent on that. It's important. All right, the next one is how much do you believe the opportunities for jobs, economic opportunity, family and social support. And you can peek and you can shout it out. How much is that? 40%, that's right. So those parts of your life are all dependent on 40% of your health is dependent on all of those pieces. What kind of access to education do you have? What kind of opportunities for economic mobility do you have? What's your family and social support systems looking like? And then also your community safety. Do you live in a neighborhood where you can easily walk around, or you can exercise, or not? Or an area where you've got lots of trees and the good air that's happening? Okay, so then the next one is clinical care. How much do you think access to the doctors, hospitals, being able to get the tests that you need, the blood drawn, what percentage do you think of that is for your health? 5%? I heard 50%. Maybe somebody thinks that like we're going to round it all out. 25%? Okay, so this is another one that's actually not as big as what we think it is. As a country, we spend a ton of money on this 20%. We spend a ton on hospitals, getting to the clinics, emergency department, hospitalizations, but it's actually in totality not that much of our health. And then the last one are your behaviors. So that's things like exercise, it's things like your mental health, it's things like alcohol use, sex, drugs, a little bit of rock and roll maybe. So rounding that out to get us to 100, that actually is a really big one for everybody. So that's 30%, your health behaviors. And so all of those things added up are what going to tell you about the length of your life, and then the quality of your life, how well you live and how long you're going to live, okay? All of you have a 5-digit number that can tell me better how long you're going to live than any other code in your life. Better than your genetic code, better than your glucose numbers, better than your blood pressure. What's that 5-digit code? Your zip code, that's right. Your zip code is going to tell me better how long you're going to live than anything else that you have. Okay. Brian Adams, where are you? All right. Brian Adams, you, on average, are living about 74.8 years of your life. That's about your life expectancy. Okay? All right? And that's based off of Casa View, the neighborhood of that, right? Yeah? All right. How about Woodrow Wilson? Where are you? Okay, Woodrow Wilson, you're actually looking a little bit better. 83.8 years is the average life expectancy for your neighborhood, for your zip code. All right? I couldn't find any schools that are in Fair Park, but does anybody live in Fair Park? Okay, a hand? Okay, so Fair Park, your average life expectancy is 65.9 years. Okay, lower, yeah? Okay. Okay, so tell me your name. Zariah. So Zariah's telling us that there's a lot of corner stores, there's a lot of liquor stores that are in her neighborhood. We're going to come back to that, Zariah, okay? We're going to talk some more about that. And then how about Kimball High? Where are you? Kimball High. Can you shout a little bit? Let us know where you are. Say hi. Hey. Kimball High, where are you? Okay. So you've got about 77.6 years is about your average life expectancy. All right. For me, here's what I see that's really disturbing about this picture. You have Lakewood and Fair Park. They're only 6 miles apart. It's 18 years difference of your life expectancy that you can depend on if you're living in one neighborhood over the other. Does anybody else think that's kind of crazy? That 6 miles? Yes, I think that is just crazy. If we can just keep the slides up, if that's possible. So something I would love to talk about is that all of those things that we just talked about, those miles that are happening, what's going on in there, there's this term called social determinants of health. Some of you may have heard of that before, but it's all of those things that we just talked about. It's the things like exercise. What is your opportunity to be able to get out and exercise and be able to be in the clean air, have better access to education, your housing, that your houses are newer. You know, one of the things I noticed when I was looking at Fair Park, the houses are a lot older in that area than they are in other areas of Dallas. What happens when you have older housing? You don't have as good a ventilation. Maybe there's more mold in there. You just have more problems. Drafty. What's that? Asbestos. Yep. Lead paint. That's right. That's right. Okay, so my name's Jennifer Valenzuela. I come from an organization in Boston, Massachusetts, is where we're based. We're all over the country, though, and it's called Health Leads. And the work that we do is we're really focusing on those things that we just talked about, the things like housing, food, access to the medical care, so insurance, daycare, so for when you have a baby, if you want to get back to work, you can do that, or back to school. My company works with hospitals. We train college students, and we have some high school students out in California. We train them, and they understand what are the resources in the community, and how do you help patients get connected to those resources that are in their community. So we've been doing that for the last 20 years, and we've learned a ton over those last 2 decades. Some of what we've learned is it doesn't matter how many food pantries we let families know about, or how many shelters or housing things that we can help with people, or removing that mold. At the end of the day, the systems have been set up in a way that it's harder for some to succeed than others, okay? And so what we are, thank you, Maddie. So what we are doing is we're trying to look at what are the systems and how do we break down those barriers so that we can start making a bigger impact. So what you say is we're trying to get further upstream. We're trying to really impact what's going on higher up the river, rather than the saying is like, instead of pulling, one problem out of the river at a time, we're trying to go upstream and seeing like what's creating those problems that are coming downstream. Okay, the thing that we also learned over those past 2 decades of working with families is even in face of all of these barriers, there's a heck of a lot of assets and resiliency that we were seeing with all of the families that we were working with. In spite of the racism that our families were coming up against, in spite of the policies that have been built in a way that it's really hard to get ahead, they still had the love for one another. They still had the resilience. They still had the strength of each other, family members working with one another. When I was working at Children's Hospital, I actually worked with teen moms and dads. That was who I worked with. And I remember so many times, like they would be getting, do you all know what food stamps are? Or SNAP is what the new name of it is. And so, they would get their food stamps, and they would go and get the food, and they would be good for a while, right? But that runs out, because the food stamps aren't enough for you to have enough food for the whole month. It's a supplement. It's meant to just help. But for sometimes, if you don't have enough to even just get by, you don't have enough to get groceries at the end of the month when your SNAP dollars are out. And so I would see this amazing resiliency with these families would come together, because maybe another family member, their SNAP dollars just came in 3 weeks later because they're on a different timeline. And so they would share their food with their family members. And then when theirs went low, one of my patients, they had their dollars, and so they would share theirs with those other family members. And everybody was working together in community to help lift up one another. And I love seeing that. But that's not going to be enough. We've got to right the wrongs that have been happening for the last couple of generations or centuries. Okay, so I'm going to give you some statistics. So this is Health Leads. So our vision at our company is that it's health, well-being, and dignity for every person in every community. Okay, that's what we're going for. All right, health equity. Let's see here. Where's a microphone? Somebody with a mic? Okay. I'm going to go to this table right in where you're in front of. Just pass it on to somebody. Who's the lucky lady or man that gets the microphone? Yep, just give it, take it. Okay. Can you read that slide for me? First, tell us your name and your school, and then read the slide.
Okay, I'm Noah. I'm from Sunset High School.
Thank you, Noah. Okay, read that slide for us. Tell us what health equity is.
Health equity means that everyone has a fair and just opportunity to be healthier. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care.
Thank you. Thank you so much. So let me give you just a quick visual of what that means. If I'm trying to get health equality, we hear that a lot. That's if I said, I want this neighborhood to be doing more exercise. That's what we need, because obesity is a major thing in this neighborhood. And so This insurance company says, I'm going to give bikes to everybody in this neighborhood because obesity is a problem and we want them getting exercising, and bikes is what they said they want. And so we're going to give 1,000 bikes to this community, and it's the same exact bike for every single person. That's equality. You give everybody the same exact thing. Equity is when you look at those 1,000 people and you say, what do you need in order to get on a bike? Do you need a different size bike? Do you need a different type of bike? If you're mobility limited, then maybe you need a hand pedal bike, not a foot pedal bike. Does that make sense? Y'all with me on that? Okay. So that's equity, and that's what we believe. There are some populations, there's some communities, there's some elderly, young, older, different races, that it's not about that they need the same as everybody else because they've had generations of times of being pushed to the side, and so they need something different. Okay, health disparities. So I'm going to read this one out loud. Or actually, can you go to another table and just hand that mic off to somebody? Yep, she gets it. The one that's shaking her head vigorously. You can do it. Thank you. Tell us your name, your school, and then read the slide for us, please. I don't think so. It's not on. Can we get that mic on? Go ahead, try again.
Sierra Walker, South Oak Cliff High School.
Great. And can you read that slide for us, Sierra? Thank you.
Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations.
You got it. Nice job. I told you we were doing master's level schoolwork here, so I wasn't playing around. Like, we've got some big stuff. These are a lot of big punch words, buzzwords that are going on in the health world right now. I don't expect you to know all of these, but really, if you think about it, health disparities is that difference between Fair Park and what was the other town? Lakewood. It's the difference between Lakewood and Fair Park and those years difference. That disparity is this gap right here between my two hands, okay? I want you guys, your challenge in a minute is going to be about shrinking that gap, okay? So what are some of the things that are impacting the life expectancy? What's happening in there? Education. So men in the room, if you have a college education, you're going to live about 5 years more than those who do not finish their high school education. So just going to college is going to get you 5 more years of your life. Yeah, did you have a question? Go ahead and. Why is that? That's a great question. So the thinking is if you go to school, you're getting more opportunity, you're getting more access to further employment, to more dollars in your life later on, which then might let you be able to live in a different type of neighborhood, which maybe has cleaner air, better schools, better opportunities for your kids, maybe a smaller commute to your job every day. And so your stress in your life, the load on you is lesser, and so then you get to live longer. Does that make sense? Great question. Okay, women, it's about 5 years difference if you go to college than if you drop out of school. So stay in school. Education, though, isn't the full answer to all of this, okay? It's also about race. Okay, so this is a big slide. Stick with me on this. I'm going to put a pointer up over here so you can follow a little bit about this. Infant mortality. Infant mortality is the number that we call for babies that die before they turn a year, okay? It's a statistic that often tells us how the health of a community is doing. If you have a high infant mortality death rate, your community is probably not very healthy. Your women, the babies, they're not able to thrive in that first year of life, okay? So this little red arrow on the left, this is white women with an 8th grade education or less, all right? Their babies are dying. They have about 5.9 babies out of every 1,000 are dying, okay? But the more education white women get, the better their outcomes are. So you'll see for a white woman that has more than a master's level, so like professional level, it's actually only 2.8 babies out of 1,000 that are going to die, okay? So that follows the curve that we think, right? The more education you have, the better your outcomes are going to be. But the really crazy thing is, that's not happening for black women. For black women, your most educated black women their babies are having worse outcomes than the least educated white women, okay? So 6.1 black babies born to black women are dying out of 1,000. There's something wrong with this story. Yes? It's not even a story, it's just facts. And so I'm hoping that you're going to help around some of these disparities that we're seeing in our communities. So this isn't just a black and white thing either. This is, in totality, our entire country is at a crisis right now. This is a list of countries across the world that you could do comparisons for. So United States is at the bottom of the bucket here. They're at the bottom of the list. We're doing worse than any of these other developed countries. So for the infant mortality, the numbers we were just talking about, we're at 6.1 on average out of 1,000 babies are dying before they turn a year. You look at Japan, it's only 2.1. So what are we doing wrong here in our country? What's that? What'd you say? Less people have babies. That's not what it is. There's something about what's happening in our country. What are we doing? How are we keeping ourselves healthy? Give me 1 second. And then the life expectancy, too. We're dying younger here in this country. We are one of the richest countries in the world, y'all. Why are we dying sooner? That shouldn't be happening, right? Got a question. Okay, can we get the mic up here so then everybody can hear? Yes. State your name, your school, and then ask your question.
My name's Zeke. I go Conrad. Like in Japan, they only allowed to have a few amount of babies.
Talk in the microphone.
They only allow in Japan. They only allowed to have a few amount of babies. But in the United States, it don't matter how many babies you have. So people having unnecessary babies, they're I ain't mean to say it like that, but they just having babies back to back. So, babies that they don't want, they gonna abort them, while the other countries they don't.
Yeah, this doesn't have to do with abortion. This has to do with babies that are born and if they're dying. It means that the conditions around them are not in a way that are keeping them healthy enough to live. And then this woman also had a question, if we can just get that. State your name, your school.
Harmony Williams and Conrad, of course. I think, I'm not for sure, that in the United States, we are less healthy. We might have health care. We might be more advanced or whatever, but we are definitely not the most healthy. We abuse it. And I know that one of the reasons that there's a very high infant mortality rate in America is because the woman's physical health affects the baby. Mm-hmm. So if you're unhealthy and you're sick and dying, and you're I think I want to have a baby, the baby gonna die too. So just there's a lot of things that go into it, and America isn't doing the best at it. So yeah.
We can do better, right? And I'm so hoping, Dallas, you all are going to help us do better. Thank you. Thank you. So one of the big things about this is how we're spending our money as a country, all right? So the United States is the top bar up there. The gray bar on the top is the amount of money that our country is spending on health care. It's about 16% of our total dollars, okay? Social care, that's things like housing, that's things like child care subsidies, that's things like food accessibility, those types of things. Our social care, we're only spending about 9% of our budget on that, all right? What do you see that's different on this graph for the United States than that's different for the rest of the countries? Yeah. United States is? They use the most money. The United States is using the most money on the healthcare. So tell us your name and the school that you're at. Yeah, just say your name and your...
My name's Alex, and the school I go to is Spruce.
And tell the group again what you were saying. Mm-hmm. What did you say? What did you just say about the graph that you saw?
I said the U.S. uses the
Talking to the mic.
I said that the U.S. uses the most money on healthcare, and that's really about it. But we have the worst
That's right, but we're having worse outcomes. You got it. Thank you, Alex.
I mean, at the same time, though, you gotta think healthcare is also really expensive over here. It's hard to get healthcare, and that's why a lot more people die off. So it's
yeah, it's not equal who gets healthcare here in this country, is it?
Mm-mm.
It's not at all.
It's really expensive.
Healthcare should be a right, just like education is a right in this country. Everybody has the right to free education. I believe healthcare should be a right, and that everybody gets access to healthcare, no matter who you are.
Yeah.
Okay, community assets. Community assets are untapped potential which can be put into action to improve communities. Part of what we want to see is that it's not all doom and gloom. All of that data that I was just showing you, I just wanted you to be able to see like what's happening in our country, what are these inequities that we have that are going on, and what's creating these, okay? But what I also want you to see is our communities have a whole lot of assets, the things that I was talking about, around how the families were sharing the SNAP as it was coming in, helping one another out, using your faith. Those are things that I believe are untapped today to make a difference in this stuff that's happening. Right now, what's really happening is healthcare systems, politicians, adults are making decisions for others without asking others, what is it that you want to do, okay? And so part of what we're doing at Health Leads is we're saying we need to all come to the table together. We need to stop making decisions for other people, and we need to have everybody together to decide collectively what makes sense. Okay, so what are assets? People can be assets. Keep this in mind, because I'm hoping as you do this challenge, if you choose this one, that you're going to think about who are the assets in our community. So Kelly Clarkson, she from here? No? She's from Texas, yeah? She's from Texas. And so Kelly Clarkson is an asset. Your mothers are an asset. Grandfathers are assets here. First responders, police, schools. Superintendent Hinojosa is a great asset that you all have here who's really engaged in this work. Places are assets. Things like your parks, a bank, and that's an empty lot on the top right. That's actually an asset. Even though it looks like it's something right now, that can be built into something. That could be built into a community center. It can be built into a community garden. There's a whole lot of potential that's happening that's just waiting to be tapped. So my challenge to you is to develop a solution to reduce the health inequity in your community. I want you to look at the assets that are living in those communities and identify also where more support might be needed. So what I mean by that is, even if we go and untap those assets that are happening in your community, that's still not going to be enough to make up for the generations of neglect that have been happening, of the generations of funding not going into communities where they need it and where they deserve it. So in addition to tapping the assets that are in your neighborhoods, I also want you to think about what else do we need? Do we need new policy? Do we need new funding streams coming in here? What else could we also need that would make this really make a difference? And how do you start reducing the health inequity? You could look at asthma. You could look at the life expectancy in your neighborhoods. You could look at obesity. This slide here, Baylor, Scott, and White did a study. They have to do, it's called a community health needs assessment. You have to do it every 3 years as a hospital, if you're a nonprofit hospital. And they asked the community, what are the top most pressing things that are happening in your community? And these were the top 6 that your neighborhood here in Dallas said we believe is the most important. And so if you wanted to look at an issue, you could look at adult uncontrolled diabetes. You could look at lack of dental access. You could look at teen births, drug use, or even just basic general access to care. Okay? All right. I thank you for your time, and I have a couple minutes to get any questions answered. Questions? Yes, Alex. And can we get the mic over to Alex? Keep that mic close, Alex.
Why is healthcare so expensive?
Why is healthcare so expensive? Who thinks they know the answer to that? Can we take it over to Conrad High? Why is healthcare so high, Alex wants to know.
I think healthcare is so high because it costs a lot to maintain a healthy life. Like, I don't think that it's just going to be low and free cost for somebody to maintain living a healthy life. So I think that they put prices high out for demand so people can reach for the resources that they need.
Okay. So you think it's expensive to just stay healthy. You want to go over there? Okay. All right. How about over here? What do you think? Why is healthcare so high? The question is. Say your name and your school, and then what you think.
Brian, from Bryan Adams High School. I don't believe it's expensive because of how hard it is to maintain us. Because I'm from Cuba, and in Cuba, healthcare is free for everybody. You don't have to pay for anything there. I feel like healthcare is expensive here just because how highly paid doctors are and stuff like that. I mean, I'm praising for it, but it shouldn't be that expensive just to help. I feel like our technology that we use to over make sure everything's okay, or how we over examine everybody. I feel like that's just why things are so expensive.
Okay. Thanks, Brian. So, Brian's seen it in another country happen. And that's some really great perspectives that you all can bring in here. If you come from another country, what did it look like in there? How is that different? What are some things that we can pull in from other countries that they're learning? Right here. I'm going to go behind you, actually. Woman raising. Yeah, you got it. Say your name, your school, and your question.
Hi, my name is Emily. I'm from Segoville High School. Well, like they said, there are many reasons why healthcare could be expensive. Some can be the medicine cost, but it really depends on what you have and practically where you come from and what type of disease you can get. Mm-hmm. And it's not pretty much focusing on like a specific thing. For example, the medicines, it could be your surgeries, it could just be in general for you. But there are many reasons. It just doesn't have to be that specific one people supposedly target. For example, to say the cost of everything. It can be everything combined in one, and it can be that's why healthcare for us is so expensive, because more people need it, and the less expensive it is, the cheaper it is. People are gonna be like, it's easy for us to get, and so they're just gonna want it and want it and want it. But it's better if it may cost, but it helps us at least.
Do you think the higher cost helps us keep people from accessing it so much?
Yeah, accessing it so much, even though they might not need it. For example, like to say the minor things, people just want to go get surgery done, and they can get addicted to some medicines, and it's better that we have high cost, but on some aspects it isn't.
Okay,
yeah.
Thank you. So I think there's lots of reasons why healthcare has gotten so expensive. Some, and I am no economist, or that's definitely not where my world is, but I will say this. Some of the world of how medicine was developed, or how the healthcare system has been working in the past, is on a thing called fee-for-service, where the medical system gets reimbursed for every time something is done. So every time you draw blood, every time you do a scan, every time you get hospitalized. And the hospital makes money off of that, right? So volume was always a good thing. The more volume, the more dollars that were coming in. That's shifting, because then the incentive is for you to be sick, right? There is not an incentive for you to be healthy and to not come into the hospitals. It's shifting now. There are shifts happening that are called value-based care, where now health systems are saying, or are getting, you're getting a set chunk of money, and you need to keep your people healthy. If they can't stay healthy, if you're not able to help keep them healthy, then whatever that costs you over that's on you. If you are able to keep them healthy enough that you're not spending as much money as we're giving you, you get to save that. That's your savings. And so we're kind of shifting to that. Some places are in the country. And my hope is that's going to get us to a place where health systems are really starting to look at the things besides just the medicine and the blood and the testing. And they're now going to start looking at housing actually matters. If I have this asthmatic keep coming back into the hospital, it's not about giving them more medicine and having them keep coming back. It's about figuring out the mold that's going on in their home, and that's what's getting them to keep coming back in here. And so if we get the health system to start thinking about it that way, hopefully we can start having healthier communities. Okay, I have time for one more question. Mr. Garcia, I'm not going to go to you because you're a teacher. So I'm going to go over here to this table. And, say your name, your school, and your question, and then I'm being told that time's up.
My name is Malachi, and I attend Thomas Jefferson High School. And I was wondering, I got two questions. I was wondering if you're committing to the challenge that you're giving to us, and what is your opinion on it, and how would you help to reduce health inequity?
So what's my commitment to the challenge? Was that the first one? I didn't quite hear. Yes? So I've been doing this for 20 plus years. I'm fully committed. This is my life. This is besides, like what Natty was saying, my family. This is what I think about all day. This is what I work with all day. This is what my company is thinking about all the time. Pretty darn committed. Actually, I'm going to put my info on here because you guys can connect with me anytime you want if you're thinking about this challenge and you want to ask some more questions. And then the second question was, what are my ideas? I'm not going to tell you because I want you all to figure that out if this is going to be your challenge. Okay, thank you for your time.
Y'all give it up for Jennifer. Give it up for Jennifer. Okay, if I could just right now get the coaches to stand up, all the coaches, please stand, please stand, please stand real quick, real quick, real quick. Y'all show your coaches some love, show them some love. Thank you, thank you, thank you. All right, everybody be seated. So where are you playing?